I first started, I was about 14 years old, and I just did it for recreational use, you know, and to help me stay up all night long and party. Then later on in years, I got a job working 12-hour shifts in a print shop, and I worked 6 days a week, 12 hours a day, and my family was complaining because when I was home, all I wanted to do was sleep. So I started doing meth just so I could stay up, you know, and spend more time with them, and it became a problem. From then on, I just had to have it more and more. I couldn't. Then I had to have it worse than my job and worse than my family.
One of our people we arrested early on for manufacturing methamphetamine had over a six-figure-a-year job and had a nice family. It was just a model family, and everyone in the county looked up to him. And once he developed a meth habit, he just went the other way. He's lost his home, and today, as far as I know, he's just living on the streets in Vermilion County. Anybody, friend, any place he can find to crash, that's where he ends up at. So,
regardless of what you call it, crank, crystal, anhydrous, ice, methamphetamine is a powerfully addictive drug. Each one of you are aware of how it's affected your health, your family, and yourself. The one particular area that we've really not talked much about, which is really one of the most obvious pieces to this material, is the effect on health, on the medical, on our health, on our medical issues, these kinds of things. We talked about the fact that the functional, the fact that meth addicts functionally come apart much quicker than other kinds of drug addicts also applies to the medical side of it. We look at the fact that just the nature of this particular kind of drug is very, very invasive to the body. You're doing a lot of unnatural things to your body on that. I mean, if you look at a lot of sedative drugs like narcotics and some of the benzodiazepines, what they're physically doing to you is not a whole hell of a lot in that. I mean, what you do to yourself and how you take care of yourself and the overdose potential and that lifestyle is more physically damaging than the drug itself. Whereas with methamphetamine, that's not the case. Methamphetamine is having profound effects on your body. You know, just the nature of that high is going to have profound effects on your physical environment.
I was 33 when I first started having heart attacks. I've had massive heart attacks. I've got a stent in my heart because of it. It's funny because the doctor, when I had my heart attack, I just went to the penitentiary like a couple days before that, or to jail for armed robbery charge. And the doctor had asked me, he said, "You've had heart attacks in the past, haven't you?" And I said, "No, sir, this is my first." He said, "No, you have scar tissue all over your heart. You've had many heart attacks, and all them times I just thought it was from doing too much dope is what the meth had done to my heart." So.
I'm 21 now, and I started noticing my teeth at the late age of 16, early 17, and just cavities more and more, and real bad toothaches, and just they were falling apart. Every time I ate, when I wasn't doing dope, I ate, a piece of my teeth would fall off, and it's just not very good at all.
Meth mouth itself is a condition that we find the teeth in, and the oral cavity and the tissue associated with the teeth. And it's usually a terribly rampant tooth decay, sometimes broken or chipped teeth from the grinding effects that patients undergo when they're under the influence of methamphetamines. but it's just the overall breakdown of the oral tissue in general, and the consequences that go along with that. Hi, Mike. Come on in. Go ahead. Come on in and have a seat. How are you today, Michael?
All right.
All righty, Michael. So you're 21 years old now. You've kind of been involved with methamphetamine use since you were about 12?
8 years.
About 8 years, yeah. Well, you know, we've only had some of your teeth in there since you've been about 12.
Yeah.
Let's take a look and see what they look like. Well, Michael, we can definitely see the breakdown of a lot of tooth structure, can't we?
Yeah.
And as young as you are right now, at 21 years old, if you hope to live until you're 75 or 80 years old, you've got about 50 years to live with tooth structure that's kind of starting off like this. So we know there's going to be some teeth that are going to be lost. Mm-hmm. There are certainly some teeth that are probably savable. Michael, I'm going to have something for you to slip in here, pal. Open kind of big for me for a second. Slide that on that side. Now, Mike, slowly just start to bite your teeth together for me. That's it, just like that. A little more. There we go. You're 21 years old now. Mm-hmm. Been involved with meth since you've been about 12. So in the past 9 years, the teeth have broken down considerably.
The single most dangerous aspect, though, of methamphetamine usage is the violence and the psychological violence that comes out of the nature of this drug, because, you know, technically you are in fact thought disordered, and in an aggressive way. And it's the same with, you know, people that you love that are exposed to you. You know, they are also in danger, you know, due to your impaired behavior.
There wasn't such a thing as going home in the evening, doing the things that you do in the evening. You know, you make your supper, then people sit down and watch TV, or you have different activities you go to. We didn't have any of that. It was like you have your battle zones at work where you just drudge through and have to do the things. But then we came home and we had another battle that we had to take care of there.
Yeah, it's very common for people, for users of methamphetamine who've developed psychotic symptoms, to become a danger to people around them. They may feel as though someone around them has been infected or contaminated in some way, and they might need to cleanse or purify them in some way. It's common for meth users to attack their family. It's very common for meth users to, because of the way the brain is working, to interpret that they are on a mission, or they need to do something about, you know, the dangerous intentions of their family members. It's very common for people to enter our unit because they've threatened someone else with a knife or a gun. Usually that's, you know, the biggest thing that brings someone to our unit is they have gotten out of control with their behavior because of their meth use.